Class, today I will be discussing the Combat Medical Aid Pack. There will be three main points in my presentation today. First, we will go over a brief history of the United States Army Medical Corps. Second, we will talk about the contents of an Army Medical Aid Pack. And lastly, we will discuss the importance of keeping our troops healthy and ready for combat. Also, before I move forward, I would like to warn everyone that some of the images may be graphic. Okay. The Army Medical Department was established in July of 1775. It is also led by the Surgeon General of the Army, who is currently Lieutenant General Nigel West. The headquarters of the Army Medical Department is located at Fort Sam Houston in San Antonio, Texas. And this is also where all combat medics, also known as MOS 68 Whiskies, are trained and certified. Okay. Next, let us talk about the most vital equipment to a combat medic, which would be the contents of a medical aid pack. Let's see. By the way, this is my ACH. This is standard issue helmet there. And this is a medical aid pack. The way we pack this is we pack by the acronym HABC, which means hemorrhage, airway, breathing, then circulation. So that is the order of how we treat a casualty or a patient that we have. Okay, so let's go ahead and open this up. Okay, and I condensed everything to three main categories for time constraints. So we're going to start with our first compartment. First compartment is for hemorrhage control. So hemorrhage control, everybody can see how the compartments are set up. We have hemorrhage control, and most important thing for hemorrhage control is going to be a tourniquet. This is a combat tourniquet. What you do is you put this 2 inches above the wound, not on the joint, and this should control the bleed. Depends on what kind of, if it's a venous bleed or arterial bleed, depends on the severity of it. But that's going to be your go-to. It's going to be your combat tourniquet. Then we have standard gauze and tape. So those are your base for hemorrhage control. Second compartment is for airway and breathing. Let's see, so we're gonna open up our second compartment. So you have two airways. You have an NPA, which is a nasopharyngeal airway. You also have an OPA, which is an oropharyngeal airway. I don't have an OPA, but I have an NPA, which is these little tubes here. This tube, put a little lube on it, shove down the nose of your patient, opens up the airway. In extreme cases, if the patient is not conscious, you're going to use an opiate. That's oropharyngeal, open up the airway through the throat. And the reason that you use that on an unconscious patient is because gag reflex. Unconscious patients not going to have that gag reflex, so you're able to do that. If the patient is conscious, then they're not going to be able to accept that airway. So, and quick little thing, each medic has to try these in medic school. So, and you're supposed to cut it directly to your length. But sergeants didn't really want to do that, so we had to take the whole thing down throat, just part of the medic training. So, yeah, Fun times. Then we're gonna go to the chest seal. This is for open wounds in the chest. This is for the breathing part. Check for a exit wound, and this should heal or contain the open wound to the chest. And then third compartment would be circulation, and that's our last compartment. So circulation, once you have the patient stable, what you want to do is you want to start an IV. Got some IV tubing, got an IV start kit. This should keep the patient hydrated, normal saline, lactated drinkers if you have someone with burns. So this is the basic, very basic of a Army medical aid bag. Okay, so turn slide. Okay, so to close, I would like to briefly discuss the importance of keeping our troops healthy and ready for combat. So studies of historical casualty rates have shown that about half of military personnel killed in action died from the loss of blood, and that up to 80% died within the first hour of injury on the battlefield. It is imperative as a combat medic that we are efficient and knowledgeable of the contents of our medical aid pack, ultimately to provide the best patient care possible so we can keep our Army up and running. And these are my works cited, and today we have discussed the contents of an Army medical aid pack. Thank you, class.